this is Dr. Shaw here today, and I have a special guest, Dr. Shelley.
Hey, my name is Alicia Shelley, Dr. Alicia Shelley. I'm a board certified internal medicine and diplomat of the American Board of Obesity Medicine. I also am the host of the Back on Track Achieving Healthy Weight Loss. And most importantly, I actually am someone who suffers with obesity. I've suffered with obesity since childhood. I was up and down. I look at the pictures and I'm like, wow, this was a big shit. And then in 2015, I underwent bariatric surgery and I was doing great. I lost 80 pounds. And then all of a sudden, I had gained 40 of those pounds, so 50%. And so I had to find different ways to help me with getting back down to a more healthier range. And now I'm in a great healthy weight range. And I call myself in remission.
I love that. And that's why I wanted to bring you on because you had that perspective of having bariatric surgery. You're also a diplomat to the American Board of Obesity Medicine. And you, like myself, are super passionate about this topic.
I can talk a little bit more about myself. When you realize that you regained a good portion of your weight back, even if it's just like 20% or 20 pounds, you're like, whoa, what just happened? And you start to think and you start to beat yourself up. You start to think, okay, what have I done wrong? But what happens after bariatric surgery is that there's an increase in certain hormones over time. And so more studies are looking at this to figure out exactly what is occurring as far as the hormone regulation. But we notice that there's a decrease in GLP-1. There's an increase in your ghrelin or hunger hormone. There's a decrease in your leptin or your satiety hormone, the hormone that tells you when you're full, and a decrease in other hormones that affect your appetite.
You are just full of so much wisdom.
Yeah. So what are the next steps after that? The next step is to focus on what is it that we can start to change these alterations in hormone. And the one thing I would say definitely, we could start with behavioral type of therapy, making sure we're in a good mental space, we're decreasing our stress, we're not allowing this to overwhelm us. And then secondly, we would take an assessment at our dietary patterns, looking at what the types of food are we eating. Have we started to increase a little bit the sugary beverages? The other thing is, are we still getting our protein in? Because that's a huge importance. Because if you're trying to combat that hunger hormone, it's easier if you have a higher protein meal. The other thing is, are we doing the things that we normally should be doing? For example, making sure we're not drinking and eating at the same time. So making sure that there's a 15 to 30-minute break between when we're eating. So we eat when we eat and then we can drink later. And then next, we're looking at our physical activity. How many minutes are we getting of our physical activity?
I also find it important to just check the bariatric lab panel. It is often missed. I would say most of my patients don't have the recommended labs that they need after bariatric surgery. When we're deficient in our micronutrients, it also does create cravings and fatigue. And if we have fatigue, we can't be our best self. This was great. Is there anything else, Dr. Shelley, that you want to add?
Yeah. The last thing I want to point out is that they've looked at, even after bariatric surgery, they've looked at how medications, anti-obesity medications can be helpful and decreasing that ghrelin or that hunger hormone, decreasing the other important hormones, or increasing like the GLP-1 hormone in the body. And that's where I definitely would sit down and talk with Dr. Shaw, because she can be able to give you that information and see if you would be a right fit for those anti-obesity medications, which I find work really well in my obesity and my post-bariatric patients.
Yeah, it is. It's a game changer. And just like anything else, if we had high blood pressure and we need to take two different classes of medications to help us, we do it. If we have diabetes and we need like several classes of medication to help us, we do it. It's the same thing after bariatric surgery. And specifically with obesity, all people want is better health. That's really the reason why people come to see us. People want to live nice, fulfilling, healthy, vibrant lives. And that's why they're here. It's not the number on the scale. So we can help you towards that journey.
Yes. Yeah.
Thank you so much for spending this Saturday morning recording this with me.